not going to stand. We're back with the panel. Michael Needham put out a statement from Heritage. You think this is bad policy?
It is. So the core of Obamacare and the core of the fight that we had in 2009 of what direction we want to take American health care was whether you go towards free markets or whether you set up a system that has lots of federal regulations from Washington, D.C. that tie people into a system where the federal government, your insurance company, and your boss are the most important people making decisions, and that because this structure is going to cause the prices of health care to go up, both in terms of deductibles and premiums, you have to provide some sort of support from Washington, D.C. to people. That's what Obamacare is. That's what needs to be repealed. The core of this plan is exactly that. It keeps most of the Obamacare regulations in place. It does nothing to alleviate the bias in our tax code towards employer-sponsored health care, and then it takes the tax subsidies provided under Obamacare and replaces them with different tax subsidies. So this is a step in the wrong direction.
Speaker Ryan addressed some of this today, saying that it has to happen in phases in order for it to get through on budget reconciliation, which means that it goes through on an economic vote in the Senate, that they only need 51 votes instead of 60. Take a listen to the Speaker.
Phase one is this repeal and replace bill. Phase two, Tom Price deregulates the market and brings certainty so that we can have more choices and more plans and get the states back in the game of being able to regulate health care. Phase three, pass those reforms that we believe in, that we think will make it even better, but we know we can't put in reconciliation because of the 60-vote threshold. We'll have 218 when this thing comes to the floor. I can guarantee you that.
218 is the number they need, AB, to get it across the finish line in the House, and obviously 51 in the Senate.
Yeah, I mean, look, I understand what the leadership is trying to do. They really believe they have to act as if they're fulfilling this promise, and sooner rather than later, not only because the program is in a death spiral, and it really is a deadline imposed upon them by the death spiral. The costs skyrocketing, the people in the pool getting sicker, the coverage worsening, the insurance companies pulling out. So they feel a tick-tock of the clock.
Which is real.
Which is real. And it's material, and they also made this political promise for 6 years. So they were going to do it on day one. So there's an urgency that you sense from the leadership about trying to get this done. The one thing they probably did wrong was to push it out tomorrow without the official projections and estimates on cost.
All right, so let's point that out. This is the markup. Explain that to people technically.
Well, a markup is actually literally the writing of law. So when you have a hearing, you have a policy debate between experts, but at the markup, you literally start to amend the bill, and you say, this is wrong. I'm going to replace this portion. And I've talked to my colleagues, and I know that I have the 13 votes in committee, and people say aye or nay, and they literally change the bill. So whatever goes in there tomorrow will change.
Right, and you're pointing out the CBO score that would score this bill. Now, back in 2009, Speaker Ryan wasn't Speaker, but he said, before Congress changes health care as the American people know it, we must know the likely consequences of the House Democrat legislation. Then, 2009, calling on the CBO score before the markup. The Democrats came July 14th, 2009, 2 days ahead of the markup, and provided the CBO score of basically how much it was going to cost and how many people were going to be covered.
Excellent work, Bret. So this is a problem politically. They already put something down that they knew both sides would explode about. So the far right is upset, the fiscal purists, and then you have the Medicare state governors like Governor Kasich saying we need to keep these people covered, and they're sort of more centrist Republicans are saying this is unworkable. Before you do that, you really need that CBO score to talk about how many people will lose coverage, what it will cost. Before then, these parties that are disinterested and disagreeing, they don't even want to talk to you about a way forward because they haven't even seen that score of your blueprint.
Okay.
There's a problem in the way, though, Paul Ryan's thinking about this, because phase one is the phase that gets done with 51 Republican votes. The only chance you have to rip out the infrastructure of Obamacare, repeal Obamacare, and go down a different pace is in this phase one, this reconciliation path. And that's why these steps that we're taking, continuing down the progressive path, are so problematic and need to be reversed.
Michael, their argument is this is how we have to do it politically in order to do it now, to clear the deck for tax reform and everything else, and to not suffer at the polls by people who are going to be leaving health care, this entitlement that they feel like they have.
Right. The great conservative victory of the 1990s welfare reform was done by completely repealing one federal welfare program on reconciliation and then replacing it with a different plan. And that's the model that should be doing here. People are giving all sorts of power to the parliamentarian in the Senate, who is a staffer, who has never had the right before to look behind the reconciliation bill and try to pull this apart. If they want to repeal Obamacare, they need to push this through the Senate. They need to get that done. And that's what's necessary to take out the architecture of Obamacare.
The message from the White House